Miscarriage. So it is a very big trauma for a female, in fact for the couple and the whole family, to undergo a miscarriage. And every patient, they think that whether they could have avoided, whether the doctor could have predicted, whether they could have avoided this miscarriage. That is the first question that comes to the mind whenever a female is undergoing a miscarriage. Secondly, what is the best process to end this miscarriage? Means what is the best process to end it, and what can be done so that they don't land up in a second miscarriage. These are some of the very important questions that every patient thinks and they want it to be answered. Firstly, there are some things that lead to miscarriage, like maybe in a uterus there is problem, there might be a septum, or there is some other anomaly which is leading to miscarriage. Thirdly, there can be medical disorders which are responsible for miscarriage. And fourthly, your gametes, means the embryos that are being formed, they are not of the good quality, so that can also lead to miscarriage. But usually when we are undergoing an IVF cycle, when we are taking up the patient for an IVF cycle, then usually all these things are already patient has undergone all the tests regarding all these things, and things are in control before we finally jump for the IVF cycle. But many times what happens that all your medical things are under control, but once you become pregnant, these medical disorders come to the fore, because it happens in a normal female also. Like a normal female, when she gets pregnant, then many medical disorders come to the fore, and it happens in normal IVF patients also. So one of the foremost causes for miscarriage is medical disorders, and for this definitely we need a multi-speciality care. And then we refer you to other specialities, like if you are having thyroid problems, if you are having diabetes, if you are having hypertension, if you are having any infection. So we need to cure all this, and this causes miscarriage in 90% of the cases. Because if you are having some anomaly in uterus and all, usually it is detected earlier, and a laparohysto is done to cure it. And if you are having problems in your embryos, many times what happens that the embryos are looking good, they are grade A embryos, but there are problems. So in these cases, obviously a PGT is done. So in patients with recurrent miscarriages, PGT is indicated, that is pre-implantation genetic techniques. They are indicated to diagnose whether the embryo is carrying any anomaly or not. So you have got all these options to avoid a miscarriage. And if still the miscarriage is occurring, then obviously there is no other option other than to go for third party reproduction. And to end the miscarriage, so there is a glaring question whether you should go for a DNC or you should go for medical termination. So what we want, because if the patient has not had conception before, and the patient obviously will be trying for more conceptions, so usually we avoid going for DNC cycles. We try to end this pregnancy by medical techniques. And thirdly, obviously we do the test of the patient. If required, we plan a hysteroscopy on this patient to see that whether there is any other things, any other defects in the uterus, and we take the tissue culture for the uterus to see whether there are any hormonal changes in the uterus, then we can avoid for the next pregnancy. This is all we can do for the miscarriage. And fourthly, but the most important factor is stress. So just be positive, have a healthy lifestyle to avoid all miscarriages. We care about you.